the person that you see every Friday. You're familiar with Dr. Mia Keys. Future doctor. We're just a year away from Dr. Mia Keys, who has been leading our discussions every Friday on health equity conversations, from COVID to diabetes to health policy. And she's been amazing and ushering in new thoughts and discussions for people like Congresswoman Kelly and Dr. Puckrin and Mr. Morial to work to implement. And then we have another man that needs no introduction. If you are a fan of the Washington football team, or from Central Texas, or if you saw a guy they call Cheetah running yesterday, the guy that's faster than him even to this day, who's always been working on both mental and physical health for everyone, but especially our youth, Mr. Darrell Green. And so the two of them will lead us in this conversation, this very important conversation today. One thing, just a little housekeeping item. One, if you have any questions or concerns, there is a Q&A box at the bottom of your screen that you can submit questions for the panel. And then two, if you just have chat or discussion topics, there's a chat box. So just make sure you keep that separate. And without further ado, I want to turn it over to Mia and Mr. Green.
Brandon, as always, thank you so much for having us today. Really excited to be joining the NMQF family as always, particularly today because we're talking about something that is near and dear to all of our hearts, whether it's because we're really for a vaccine or we're not sure or we're really against. What you're going to receive today is going to be really helpful in helping you to make firm decisions about how to take care of your health, especially because we've not reached the end of this pandemic. So, and I'm also just very excited to be joined again by Mr. Darrell Green. Darrell, how are you tonight?
I am great. I am great, Mia. I am humbled to be with you, and everybody know everything about you. You write books, education, future, very soon to be a doctor. But the thing that I want people to know, that really everybody that have spoken to me, is they talked about your personality and they talked about your arms. They talked about how beautiful your arms are. You can tell them a little bit about that. I know you play tennis and all that stuff, but on a serious and sober note, what a special night for all of us. I pray that people get into this system, no problems with their technology, and that this is going to be an extraordinary day that's going to be transformative, in my opinion. So I'm grateful to be here. Bless you. Let's do this.
I'm also grateful to be here. And that's funny. I see the Congresswoman laughing at the arms comment because she's someone who would talk about that. But I mean, for all the things that I've been blessed to do, I can't run, a 40-meter dash in less than 5 seconds, Darrell. So, we're certainly in good company today, keeping each other inspired. But let's talk about, two other inspirational people who are going to help lead us in today's conversation and who have helped to sponsor today's conversation. So first and foremost, the CEO and president of the National Minority Quality Forum, we have with us Dr. Gary Puckrin, who, as the leader of the DC-based nonprofit, has which he founded in 1988, and at the time I was maybe 2 when he founded that. But this man has certainly really led the mark with respect to how we think about communicable diseases, chronic conditions, social determinants of health, and recently, certainly political determinants of health. So Dr. Puckrin, I'll leave you with words to start us off today.
Well, Mia, Darrell, thank you so much for moderating this evening. What a special treat for all of us, and to Congresswoman Kelly, who is fighting the good fight up there on the Hill. We got your back. We understand it's crazy up there, but there's an army behind you, so don't fear at all. And I want to thank Derrick Johnson and Mark Mariel for joining us, and all the other panelists who will be presenting this evening. I just want to say a couple of quick words about the National Minority Quality Forum. For those of you who may not know who we are a research and education organization based here in Washington, D.C. Our work has really been focused around collecting health data, which we've been doing for about 20 years. We have a database of over 5 billion patient records. We collect data on about 160 million lives a year, covering about 72,000 conditions. We have really taken this COVID problem to heart, particularly its impact on minority and underserved communities. We have partnered with Centene, and I know Dr. Gloria Wilder is joining us here this evening, and I'm sure she's going to talk about the 5-year study that we're doing on COVID in minority communities, collecting a lot of data to try to understand why the virus is presenting itself the way it is in minority communities. I want to alert you to 2 projects that we've got underway. One is Healthnet. This is really going to be, I think, a game changer. We are using machine learning and big data analysis to help minority and community-based organizations optimize their internet websites and really using what Facebook and Amazon and all those folks who have been using big data in our community has not really been in that world. I think you're about to see a whole new day very shortly over the next couple of months. I think Healthnet will be something that we'll all be talking about and collaborating around. The other one is the COVID Index. As I told you, we collect health data. One of the things that we were struck by is COVID is highly predictive, right? It grows exponentially. And so we've been working, again, with a group called Public Democracy to do predictive analytics, to predict where the virus is going to surge before it in fact occurs. If we had used that data very, very early on, we would not be in the trouble that we are with the virus. And so we're stepping up to make sure that communities see the surge coming before it actually hits. And the idea is that they'll be able to use their resources for vaccines, COVID therapeutics, as well as getting folks to wear their masks in order to mitigate the risk. And then finally, if you go to ourvaccine.org, you'll see some of the coming attractions with Healthnet. It's a microsite that we put up that is helping to educate people about vaccine hesitancy. And I think it's a really unique undertaking. So you can go right now to ourvaccine.org and you'll see it. So anyway, I want to thank you so much. We're excited about this, lots of lessons to be learned, and I'm going to turn it back over to Mia.
Thank you, Dr. Puckrin. And with some of the links that he mentioned, or rather some of the projects that he mentioned, we'll get some of the links up in the chat as well. And I just want to reiterate, for any comments that you have, put it in the chat on the side. For any questions, put it on the bottom. And I am completely biased for introducing this next person. She is a personal hero, former yet forever boss, Congresswoman Robin Kelly, who I had the pleasure of working for and still think very highly of in my heart and in my mind. She serves the 2nd District of Illinois, 2nd Congressional District, where she has basically worked at every single level of government. You know, the woman is truly a public servant in heart and in action. Currently, she serves as a member, a leading member on the House of Representatives Energy and Commerce Committee, which, if you're not familiar with ENC for short, it's the main policy writing body of the House of Representatives. And particularly when it comes to healthcare related policy, Congresswoman Kelly has been a major leader. She's also a member of the House Committee on Oversight and Reform, which is where a lot of conversations around civil liberties, civil rights, that's where those conversations especially take place. And that committee was formerly chaired by the late and great Representative Elijah Cummings. So Congresswoman Kelly certainly leads the helm there. I can go on and on about all the things that she does. I'm just going to name a couple more things. She's also the co-chair of the Congressional Gun Violence Prevention Task Force. She's the author of the 2014 Kelly Report on gun violence in America, which is the first of its kind, first ever congressional analysis of the public health threat of that gun violence is. It offers a blueprint for ending that crisis. And then just a couple other things. She serves as the chair of the Congressional Black Caucus Health Brain Trust, which is how I came to work for her. And she's also the co-chair of the Congressional Caucus on Black Women and Girls, where you're talking about especially intersectional related events for the Congresswoman to lead members of Congress and policymakers and innovations in that space. We're so very grateful that she does all that she does. So Congresswoman Kelly, I leave it to you to just give us some opening words, ma'am.
Well, thank you so much, Mia. Always good to see you. Good to see you, Mr. Green. I have to tell my brother that I shared a Zoom with you. he has never left New York, but he's a big Washington football team fan. So I have to share this with him tonight. But I want to thank everyone for joining us tonight for this very important conversation. And of course, always good to be here with Dr. Puckrin. We do so much together, and you've taught me so much. And joining us in National Urban League and the NAACP. Great for all of us to be working on this very important issue together. And also thanking Centene for joining us tonight to talk about their important work on vaccine development and research. Now, as far as the topic of tonight, it's so important for us to have this discussion because we know we need to persuade people in our communities to take this vaccine. I will share with you that I've had both my shots already, and so far so good. Didn't even hurt, and I'm a chicken when it comes to taking shots. But I took my last shot last week. And I know a lot of people are concerned that they did this so quickly. And how did this happen so quickly? And then also calling it Operation Warp Speed. I don't think that was the best name because that fed into that people think they just threw things together, but they really didn't. It's important to understand that scientists across the world have worked for years on corona family viruses such as SARS and MERS to understand their method of causing infection and using that knowledge to develop the vaccine. As COVID-19 has shown us, though, politics impacts our health in ways that we overlook in daily life. But the politics behind the scientists at NIH and the FDA is simple: saving American lives. And in our communities of Black and Brown, Indigenous Americans, we continue, unfortunately, to have a high rate of loss, with both groups now representing or experiencing a COVID-19 death toll exceeding 1 in 750 nationally. To break it down a little further, Pacific Islanders, Latinos, Blacks, and Indigenous Americans all have a COVID-19 death rate double or more of that of white and Asian Americans, who experience the lowest rates when adjusted for age. It's not all bad news, though. Our nation has finally reached a key step in fighting against COVID, distributing the vaccine. But we have a number of hurdles to overcome. One is which is the hesitancy that we hope to deal with in this discussion tonight. And we understand because of disturbing mistreatments, and some of it goes on today, the lack of access, something I'm passionate about, maternal mortality, what happens to Black women across this nation when they're having babies. So we understand why people have the hesitancy, but things have improved. They really, really have. And if we're going to stop this virus, we will need as many people as possible to participate in getting the vaccine. And we will be making sure that the vaccine is distributed equitably so that you can get the vaccine. The other thing, just it bears reminding, you have to wear your mask, you have to physically distance, and you have to wash your hands. But we know, hopefully in this conversation, you'll start to feel that you can trust the vaccine more, the medical community more, government more. We know we're part of the problem, also, and that there will be people around you that have taken the vaccine and that you'll see that they're okay from taking it. So we need everybody's help. Government cannot do it alone. We need everybody to participate. So again, thank you for joining us. Please ask your questions. That's how you learn, and that's why we're here to answer them. So hope you get a lot out of tonight's discussion. I want to thank all the panelists again, and Mia, I will turn it back to you.
Thank you, Congresswoman. I'm going to turn it over to Daryl, who's going to introduce our next speakers as well.
And thank you as well, Congresswoman. These next two gentlemen, they need no introduction, truthfully. They bring such credibility to our town hall tonight, and I'm humbled to be able to introduce them. The first one is Mr. Mark Muriel, deep into his second decade as president and CEO of the National Urban League. And I remember that when he wrote the book, Gumbo, the Gumbo Coalition, which is a collection of lessons on the power of unity in our democracy and leadership framework for America's change makers. Mr. Muriel, please take the mic. Thank you for being with us. may have to unmute.
I'm sorry. Good evening to everyone, and thank you for having me tonight. I want to express my appreciation to Representative Robin Kelly for continuing leadership and friendship, and her advocacy on gun violence continues to be a standout performance on an issue that continues to nag our communities and our nation. I certainly want to thank the National Minority Equality Forum for the research and for the work it does to mine data and to position data so that we can be good, solid public policy decision makers. And it's always great to be with Derrick Johnson, my brother in the civil rights struggle, who is bringing the NAACP to new heights. Let me just offer a few observations. It is hard for me to fathom that we're almost a year in to this COVID pandemic. And as we look back on the last year, the deaths, the illnesses, the disparities have shocked us, have pained us, because the people who have died and who've been sick, they are our mothers and fathers and grandmothers and grandfathers and uncles and aunts and sons and daughters and cousins and cousins and neighbors and friends. I've lost several friends due to COVID. My wife and I had COVID at the very beginning of March of last year. We knew not what it was. We suspected that it was COVID, but it was at the very beginning when you couldn't get tested. And there were no tests, and doctors wouldn't see you and hospitals wouldn't see you unless you had severe symptoms, which thank God neither of us did. As we stand today, we now have a president and an administration that will take this pandemic seriously, discontinue the clowning, the reality show performance, the denial of science, the rejection of data, and an administration, and we have to underscore it, that made a bad situation even worse and cost us lives due to its incompetence, ineptitude, and lack of focus. That being said, for Black America today, we now face rising unemployment, threats of evictions and foreclosures, the loss of wealth through the closing of maybe 1/3 to 40% of our African-American businesses. And it's troubling to me that some people on one side of the aisle in Washington, D.C. could, against this pain and this backdrop, say after they voted for massive tax cuts for wealthy Americans that a relief plan that's on the table is too expensive. That not being said, notwithstanding, in our community right now, we have to meet people where they are when it comes to the vaccine, acknowledge the disparities, the history of Tuskegee and beyond. But I think we also have to remind people that it is a young, talented Black scientist by the name of Kizzmekia Corbett who's led this research effort, a mentee of the great Freeman Hrabowski at the University of Maryland, Baltimore County, that a Rhodes Scholar, Oxford-trained African-American doctor who heads Meharry Medical College, Dr. James Hildreth, was on the advisory panel that recommended the emergency use authorization. We have to remind people, and we're going to have to educate people, that 25% to a third, according to the numbers I've seen, of the clinical trial base on these vaccines have been diverse. and that Tuskegee is hurtful. Tuskegee is painful, but this is not Tuskegee. And this is not Tuskegee because we must weigh whether the cost of not taking the vaccine is more than the price of taking the vaccine to our community. So we're going to be involved in an effort, as we have, to educate people, not to pressure, not to shame, not to do anything other than to provide people with basic information to make an intelligent choice. I've been challenged on whether I would take the vaccine. My answer is that I'll consult my physician. I will consult my physician. I will not jump the line. And I'll wait my turn. And if my physician, who happens to be an African-American woman, says that it is safe to take it, I will take it. And we have to help our community understand that decisions like this should not be made based on what you hear on the internet, what you see on errant voices on television and cynics, but should be made by following the guidance of trusted African-American doctors, physicians, and scientists in our community. And that is so important. We have to beat this. We have to get beyond this. It's placed us in a situation where some 20% of our children have dropped out of their learning experience because of their inability to navigate in a virtual environment. And the pain and the difficulty and the challenges are great. The lucky amongst us can work from home. The lucky amongst us can maintain our organizations, our agencies, and our businesses. But many, many among us, these have become the worst of times. A pandemic, economic downturn, racial injustice. So we must work and we must fight. Finally, I'll just offer that we're proud at the National Urban League to be working with Dr. Reed Tuckson and the group, the Black Coalition Against COVID, which includes the 4 deans of the Black medical colleges in the United States, the National Medical Association, blackdoctors.org, and the Black Nurses Association in this effort to educate the community and move things forward. So I'm glad to be here tonight, proud to be able to contribute to the conversation. I want to thank everybody for their work and just say we must work together, we must collaborate, and we must beat this pandemic.
Thank you, Dr. Mariel. As I mentioned, these gentlemen bring so much credibility to our event tonight. And as he mentioned, Derrick Johnson is a man who he's leading an organization that has been around for since the beginning of the early century of the 19th century. And so when you think about that, it reminds me of being a football player. You know, I used to be with the Redskin team, but it wasn't the Redskin team, it was the people in the jerseys. And this man represents people great and small for almost 200 years. And it's my privilege to bring him to this time. And I'm humbled by this. I mean this with all my heart, for you men and women to be a part of this. We need this. So please, President and CEO of the NAACP, Mr. Derrick Johnson, please let us hear from you. Thank you so much.
Thank you for the introduction. I just know I'm a Detroit Lions fan, so I'm used to having high hopes at the beginning of every season. I want to thank Gary and Brandon for inviting me to bring some opening remarks, to my brother, Mark Mariel, and to Congresswoman Kelly for setting the tone of the importance of what we are confronted with. In the midst of this global pandemic, a global pandemic that has impacted our community in ways in which none of us would have imagined just a year ago. The fact that it was global in nature And in this nation, we did not have a true federal response. And so for those of us in the advocacy community, our goal is to advocate to ensure that there's a federal response. When you're dealing with a health crisis of this magnitude, that's viral in nature, you cannot hope that artificial boundary lines, geographic lines of states will contain it. So one state would do one thing and another state would do another thing. And the result of that has been one of devastation to far too many communities, far too many families that have seen their loved ones depart and them not be able to celebrate their life in the traditions that we celebrate in the African-American community. That's heartbreaking within itself, the fact that so many suffer in medical facilities and their loved ones cannot go see them in those medical facilities. The fact that the most vulnerable individuals are also the critical workers to keep society moving. We have not provided the type of support, either financial or PPE support, that's necessary so they can keep our society moving. As advocates, we were pleased to see a change in administration. But just like Theodore Roosevelt, where they in words say they agree with you, you still got to make them do it. We got to make sure that as the COVID relief package move forward, that those who are most susceptible of contracting this virus, whether they're critical workers or vulnerable because of health ailments, or the fact that they have been left out of the true economic picture of this nation, we got to make sure there's a prioritization for those communities. That there is no reason why we will run out of vaccines the way we have run out of vaccines across this country. That the lack of logistics should not be quarantined for those who are trying to make profits off of distributing the vaccine. This should be an all-out effort using the best logistical minds and team on the globe, and that's our U.S. military. Logistics is what they do to make sure that the communities who are in most needs are provided with the access to the vaccines early and conclusively are able to move forward, because those are the same individuals that we depend on to keep society moving. Where I grew up in Detroit, Michigan, many people see it as a blighted community. But I love that community. I love that community because I've seen people get up every morning and go work hard to be underpaid. I love that community because I've seen people go to the afternoon shift and go work really hard and be underpaid. I love that community because I've seen people be on a night shift and work all night and only to get home to try to provide for their children, get them ready for schools. Blighted communities are not a symptom of the individuals who live in those communities. Their problem, blighted community is a result of systemic and structural racism that have created barriers and locked people out of the opportunity to progress. I am one of the lucky ones only because I was able to navigate through a bunch of landmines that were put in front of me and a few gracious mothers and brothers who pulled me through there. But that should not be how we operate in this society. And that definitely should not be how we determine who have access to a vaccine and who will not get access to a vaccine. So as we are in the midst of this pandemic, the best thing we can do as a community is share information like the platform with this town hall meeting we're doing tonight. Because it's through these communications that we are able to provide critical advice and direction and support. And I'm not telling people to take the vaccine or not take the vaccines. I am telling people to exercise your options and be educated about what those options are. Whether it's enhancing your ability to socially distance, which is difficult to do for some people. But for some people, social distancing could also lead to social isolation, and mental health is serious. And so we have to watch for that as well. Whether or not we begin to double up on our masks. I was reading an article today with the new strand that we may have to double up on our masks. Some of us go to work every day only to come home with elderly parents and family members who live in those homes. So we may have to even wear our masks in the households that we reside in. Whatever those options are, it is our goal, our job, not only as an organization, but Gary, for your organization to give us direction that's necessary. So thank you for pulling this together, and thank you for your leadership in this space.
Well, thank you for being a part of this tonight, and I apologize for my enthusiasm of calling your organization 200 years old, but just a little over 100 years. But
well, it's 112 years old as of upcoming March 12th. I pulled out my Image Awards statue because this year we're going to have our Image Awards in March virtually. So I hope you all tune in. I'm not going to win it, but I like looking at it.
Well, absolutely. Mia, I'll turn it over to you. Let's move us forward. Thank you, guys.
Thank you so much, Darrell. And thank you, President Johnson, and thank you to Mr. Morial, Congresswoman Kelly, and Dr. Puckrin. We're going to now go ahead and switch over to our panelists. I invite all of our panelists to join us visually. We have quite a lineup for you. And so if each panelist, as you're being introduced, and Darrell will introduce our first panelist, tell us your current role and company in 30 seconds. You can also just express to us as vehemently as possible what makes you join us here today.
Well, let's start with one of my dear friends here, right here in the nation's capital, Washington, D.C., Dr. Gloria Wilder. She's Vice President of Innovation and Health Transformation at Centene Corporation, and she's President and CEO of Core Health and Wellness Centers. Hello, Dr. Gloria Wilder.
Okay, I'm unmuted. Hi, Derrick. I am so excited to be here tonight, and I am just really, I'm just feeling all of the energy of the ancestors as I hear all of us talk about this very important issue, because in order to solve this challenge in our community, like every challenge in our communities, it really takes us coming together and having some truth-telling sessions, right, about where fears have lied in the past, what's the truth, what's fake, you know, what are people doing? And I'll just tell you, y'all who know me know I'm from Brooklyn, right? And you can't get the Brooklyn out the girl, right? I'm still Bed-Stuy. And the truth is, you guys, we have in our nation seen tens of thousands, hundreds of thousands of people die who did not need to die from COVID-19, right? Because of lies, you know, because of misinformation, people hesitated to do something as simple as wearing a mask, right? To do something as simple as staying 6 feet or 10 feet away from each other. Right. And now that there is a vaccine available, the same types of lies and misinformation are making people do something as crazy as hesitating to get a vaccine when it could save their grandmother, right? It could save their child. Remember, the vaccine's not available for children yet, right? And I'm a pediatrician, right? You guys introduced me, you know, I'm in addition to being Vice President of Innovation and Health Transformation at Centene, you know, I'm also a pediatrician. I run 2 wellness centers that I own in Washington, D.C., in Wards 8 of Washington, D.C., one of the most economically impoverished parts of the city. And every day we take care of kids who don't have a choice. There is no vaccine for children. So they're going to count on their parents and their grandparents getting vaccinated so that they get protected, right? Until a child's version of the vaccine comes out. And this is what we need to talk about tonight, right? Is this real idea of what does it mean to be part of a family that's part of a community that's part of a nation? And what is
We're going to get into all of that, Dr. Wilder, for sure.
Okay.
You bring up, you bring up so much, and we're going to unpack all of that. And this is going to be a no holds barred conversation. I must apologize in advance. Someone else wants to be introduced, the dog. So if you see someone popping up, it's not me just fiddling around. He's here and he's anxious. But I do want to bring another one of our panelists to the conversation, Dr. Reynolds Verrett, who joins us as the president of Xavier University of Louisiana, to talk to us about the HBCU perspective. And if you can, sir, just give us 30 seconds of why you're here and what perspective do you feel is really important for the audience to take away?
Well, not only am I bringing the perspective as president of Xavier University, but we educate many physicians and scientists, but also as an immunologist and scientist myself. Early in the epidemic, my concerns were that we saw very low participation in the vaccine trials, And that was improved significantly as a result. It was also that I saw 400,000 dead, now 500,000 coming, is not just an emergency, it's a catastrophe. And that it is important that our populations be protected, and the vaccine is a solution. And the vaccine has been tested very well. The safety and efficacy has been tested. And there's reason to say, not only do you take the vaccine, protect yourself, protect everybody else around you as well. You have to think of other people as well.
Thank you, sir, for that. Darryl?
Thank you, sir. Next up is Dr. Akila Jefferson Shaw. She's Assistant Professor of Allergy and Immunology at the University of Arkansas for Medical Science. Dr. Shaw.
Thank you for having me tonight. I'm very excited to be a part of this conversation. We all know that COVID-19 has devastated Black communities and other communities of color here in the US. And really one of the most important ways to curb the pandemic is through vaccination. I study health disparities, I study allergy and immunology, and I study health policy and ethics. And as someone who studies and understands the immune system and vaccines, I've been concerned since the beginning of the pandemic, really, that Black communities and other communities of color will be left behind unless we have a plan in place for equitable vaccine distribution for all of us. Really, I hope that at the end of today, we have a better understanding of how we're going to build trust, again, among these communities, among our communities, and the importance of all of us being leaders in this road to ending the pandemic.
Thank you, Dr. Shaw. Really excited that we have two immunologists to join us and help us unpack these conversations. We're also joined by the fantastic Dr. Darryl Richardson-Heron. Thank you so much, Dr. Richardson-Heron, for joining us today. She joins us today as the Chief Patient Officer at Pfizer, and a lot of people are really curious and have questions about the Pfizer BioNTech vaccine. So I know that she'll be bringing us some information. Dr. Richardson-Heron.
Thank you so much, Mia. It's always great to see you. And thank you for the other panelists and speakers. I have the pleasure and responsibility of serving as Pfizer's Chief Patient Officer. And I often describe myself as a physician by trade and an advocate by choice. And, you know, I say that because I trained at the Bellevue Hospital, which those of you who are not in New York, but many people know is the oldest public hospital in the United States. And, you know, kind of looking back at that, it was an inflection point because it was at Bellevue where after years of study in medicine and academic settings, I saw real patients, most of them from underserved communities who, through no fault of their own, presented with late stage disease, often because they had limited or no access to healthcare. So, you know, that really was a life-changing experience for me and put me on a fast path to try to figure out how to eliminate health disparities. And at Pfizer, you know, my work focuses on making patients, all patients, our North Star. And as to why I'm here to listen. I'm here to learn. I'm here to answer the questions you have. And if I could share one message up top, it's that we stand at a junction here, an inflection point, if you will, to leverage whatever we have. As leaders, I feel like it's our collective responsibility to make sure that we leverage our platforms, our position, and our power to make sure that historically underserved communities who are already on the margins don't suffer even greater disparities and unnecessary death as a result of the pandemic. You know, I think about, you know, Dr. Martin Luther King, you know, his stated words of, and he says, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. So I'm really here to make sure that people have the information they need to make the informed decisions for themselves and their families.
Wow, awesome, awesome. Ladies and gentlemen, next up is Dr. Gary Gibbons. He is the director of the National Heart, Lung, and Blood Institute at the National Institute of Health. Dr. Gibbons.
Yes. Well, thank you very much. Delighted to be part of this conversation. Appreciate the leadership of Congresswoman Kelly, Gary Puckrin, and others put this together. It is my role as director of the National Heart, Lung, and Blood Institute, a $3.5 billion research agency, to pursue science and be part of the overall NIH response to the COVID-19 pandemic that indeed has a great impact on the heart, the lung, and the blood systems that our research agency studies, and where we have a high priority in addressing health inequities. And so this COVID-19 pandemic is a convergence of both of those elements, and that's why we're at the fore. In addition, I've been asked by the NIH director, Dr. Francis Collins, to co-chair a program that's a critical cornerstone of the NIH response to COVID-19. It's called the SEAL program, Community Engagement Alliance Against COVID-19 Disparities. And indeed, we've been partnering with organizations such as Black Against COVID-19, with Reed Tuckson and others that have been part of creating these forums where we're addressing the misinformation, mistrust that stand as barriers to what we can do to more effectively protect communities of color that are most devastated by this pandemic. Our objective is to use science to crush this COVID pandemic and ensuring that those communities that are disproportionately affected are amongst the first to reap the benefits of the science that will eventually end this pandemic. And we ensure that that's done in a way that aligns with health equity and justice. And that's part of our mission, to turn discovery science in the health of all communities. And that's why we're here tonight. Thank you.
Thank you, Dr. Gibbons. And we also have with us today Dr. Debbie Chapman Bryant, who joins us as the Associate Professor and Associate Dean for Practice at the Medical University of South Carolina, South Carolina College of Nursing, Musk College of Nursing. So thank you so very much for being here, Dr. Bryant.
Yeah, thank you so much. Yes, I'm at the Medical University of South Carolina in Charleston, South Carolina. I am so pleased to be with you this evening, and I am just honored to be a part of this panel with individuals who are respected and admired. And for that, I'm humbled and grateful to be able to join you. Before this weekend, I would have simply stopped by saying I'm a nurse, and I come from a nursing perspective as a community and public health nurse who has served in that area of health promotion and early detection most of my career. But I also want to say, as someone else did previously, is that now I also joined the almost we could say the movement, the Me Too moment, the moment of someone who has really lost someone near and dear to them from this virus, and have some dear friends who are very ill today. And so sending prayers to them as well. So that's a class we don't want to be in, but unfortunately we find ourselves. So I am very happy to be a part of this discussion. Thank you so much.
And we're so happy that you're here and that you all are here collectively, panelists. 400,000 people to date, have certainly lost their lives, and we grieve with families. Among us, many of us are grievous of our family and friends who have lost their lives to COVID, and many in the audience are feeling the same way. And so certainly there are trepidations about the vaccine, even in the wake of such loss, right? So I want to check in with the audience and see where everyone is. There's a question that's going to prompt on your screen. I want to know, do you have any apprehensions about taking available COVID-19 vaccines? And go ahead and put your answer in there. We're going to come back to that, but I think that information will help the panelists to eventually speak to some of your own trepidations collectively. But I want to, again, just remind you, if you have questions, put them in the question and answer box below. Keep the comments coming. We see a lot of chatter in the chat. That's fantastic. I want to open up with the first question for Dr. Shah and also for Dr. Richardson-Heron here. We're doing this town hall for everyone, but we're specifically talking to African Americans across the US. And as Mr. Morial spoke earlier about the role of mistrust and distrust, the history of all of that here in our nation, it's very difficult to have this conversation around COVID-19 vaccines without acknowledging that our past in terms of mistrust and distrust of institutions, of care providers. Can you help us to unpack the significance of trust when you're talking about having a conversation as heavy as COVID-19? Dr. Shah, I'll go ahead and turn that over to you first.
So thank you. Again, I think at the very beginning of the pandemic, there was a lot of blame game that was going on as far as why people were getting sick, why people were dying. And it really further eroded the trust that a lot of Black Americans and other people of color in the United States have in the biomedical kind of research and just clinical medicine field. So, from that standpoint, we have to rebuild all the trust that has been lost from historical abuses, from present abuses. We know that there's been lots of issues with access to testing, access to treatments with COVID-19, access to research, access to experimental therapies, and so on and so forth. And as we kind of move into the vaccine story, or as we're moving into the vaccine story, we really have issues where people are very mistrustful for good reason sometimes about how the research was done, given our history. And so I think, number one, acknowledging that legitimate concern is the first thing, and not really just dismissing people, which I think at the very beginning of the pandemic, there was a lot of that going on. Making sure we are hearing everyone, we are acknowledging everyone, and then that we counter that with good information, good data, good facts. There's so much misinformation out here right now, in particular about the research that has been going on with vaccines. And so really countering that with what is really happening, what really went into development of the vaccines, and making sure we are good sources of information for the public.
Thank you, that was well said. Dr. Richardson-Heron, if you wouldn't mind building off of that.
Yeah, and I certainly echo everything that Dr. Shaw said. The other thing that I would say is, we talk a lot about, historic transgressions, but there's a lot of things still happening. I mean, simply put, communities of color are not always treated with the kindness, the concern, or the respect or dignity that they deserve by the medical establishment, even now. I don't want to dwell on that, but, I often hear people talking about mistrust. People have mistrust. Well, it's been well earned. And I think what we have to do is change the narrative and change that dynamic and demand more of our systems. I mean, remember, getting back to vaccines, vaccine hesitancy didn't just start with the COVID-19 vaccine, right? Only an estimated 45% of American adults received the flu shot in the 2018-2019 flu season. And that was numbers even smaller when you talk about African Americans or Latinx populations, which 39% of Black Americans and 37% of Hispanics receive the flu vaccine. And, I think, one of the things that we can do is make sure that people are aware of the many policies and guidelines that have been put in place to protect patients and research subjects. But some mistrust is hard to undo. I mean, you can't just undo it by saying it needs to be undone. We really do, as was said earlier, have to meet people where they are, respect their concerns, answer their questions. And another thing I think that we can do, and this is something perhaps that we can talk about a little bit later, is to make sure that the messenger is correct. The message is important, but the messenger is really correct. And, there's been a lot of research that has shown that multicultural leaders and figures of authority can have a real positive influencing factor, whether that's our religious leaders, whether that's the Greek organizations, Pan-Hellenic, like the Divine Nine, African-American healthcare professionals. When we have people of color or multicultural people who are respectful of the individuals, oftentimes the message can be received well, but this trust is well earned. And while I'm not harboring on that, I just think that it's important for us to recognize and meet people where they are on their trust journey and dispel any myths that are out there. But at the same time, recognize and respect that it is unfortunately well earned.
Trust is well earned, for sure. I'm sure Daryl's next question will help us to make connections between why trust matters. Thank you.
Wow, this is, gosh, why are we not on national primetime television? This is so special. Oh my gosh. So let's jump into this. This is sort of a multiple questions, and really, in some of these things as we go through, you'll sound like you heard them before, but I think it's well worth it. And Gloria Wilder, you'll jump on this as well. Let's say, what can you say to some of the common fears and concerns, such as being able to get COVID-19 from receiving the vaccine? And I'll continue, and hopefully you guys can stay with it. I'll read it again. The next part of it is that the vaccine was developed too quickly. We talked about that, someone mentioned that, and therefore not trustworthy. And then finally, this is one very important, And the individual shame, what a deal. The individual shame, and I've experienced that, and guilt around receiving a positive test. Please, Gloria, would you please start off with that, Dr. Wilder?
Those are all very heavy pieces.
Yes.
And I love what Dr. Heron said when she said the mistrust is real, right? And that's the first step in all of this, is acknowledging to each other, right? That this really happened. Tuskegee was not a lie. And there have been other Tuskegees, right? Those of us who know about obstetrics and gynecology know that the basis of obstetrics and gynecology was built off of abuse of enslaved women. So there are these real incidents, but I think our job in this is to now take that and say that there are a few of us, and unfortunately not enough, who have made it to a level within our communities where we are in rarefied air, right? We have all these letters behind our names. We've graduated from all of these schools, and it is our responsibility to bring back the truth into our communities. The challenge that I see in the communities that I serve and the communities that we serve through Centene all across the country is that so many people don't get any information, not even good or bad information. They don't get any real information except through conversations with neighbors or somebody else who's scared, or my aunt said this, or did you hear that this person got a vaccine and this happened? So I think it is our responsibility to once again reestablish the communication channels, right, to address these fears. COVID-19, getting the vaccine can cause you to get coronavirus or to get COVID-19 is one that I've heard people say in my clinic, right? And we'll sit and we'll talk about it, and I'll go through, you know, exactly how vaccines are developed, and, you know, how a shot goes into your arm, and what's your immunity and how your immunity builds up. I take the time to have that conversation. And tonight we get to have it in a quick way, but I think our responsibility moving out of this is to take it back into our individual communities and really start to have really defined conversations, but also marketing materials from larger organizations and smaller organizations that get to the heart of the questions, right? Don't dance around the question with fancy language, right? Let's just tell the truth.
Dr. Wilder, just go 30 seconds on that last part of the individual shame and guilt. What does that come from? That don't tell my cousin, my mama. What is that? I'm actually, unfortunately, I'm being personal in this. What is that? Is that
I think, and I'm gonna just say, I think there have been a number of times in our community where disease or disorder has been seen as something to be ashamed of, right? We've seen this multiple times when there have been large outbreaks of even things like the flu, right? But let me just remind you guys of a time that wasn't so long ago in the 80s when we discovered this virus that was going through the country, and it was killing men, right? And mostly gay men initially, right? And then it started to kill children and women, and people started to change the name from gay men's cancer to this name of HIV, right? And HIV caused this horrible thing called AIDS, and people didn't want to say that they had this virus, right? And children who got this virus, right, they were isolated in schools and weren't allowed to attend certain schools. So there's a history behind this shame, right, of giving something to somebody or being a carrier of something, or you didn't protect yourself, or this blame and this negativity around disease, disorder, or anything in a community that could cause harm. We've got to end it. We've got to end it, and it starts with us, all the trusted, advisors, right, coming to folks and telling the truth, right? That coronavirus is something that spreads, right? You could be walking by somebody, right? So
I apologize cutting you off. I want to get Dr. Gibbons to jump in. I don't want to run out of time, but I certainly do appreciate that, and I'll call you on that anyway. Dr. Gibbons, will you please join in on that, on this conversation with us?
Well, related to that question, I think one of the things that Dr. Wilder brought in about the shame also is important in terms of the testing. The testing positive in COVID as compared to HIV meant that you're exposed. And so the exposure of this virus, which is spread around through the air we breathe, who are the people who are most likely to get exposed? Well, it's people who often are in occupations that bring them in high contact with the public. And because we learn after a while that this virus is spread by people who don't even know they're sick or have symptoms of the viral infection, they can spread it through the air. And so that's why the bus drivers, the healthcare workers, the frontline workers, the grocery store clerks, those in meatpacking industry, those are occupations that often have communities of color as major employees. And so part of the ravage of this virus on communities of color relates to the type of work and exposures that people who live in those communities have on a daily basis. And some were concerned that if I tested positive, that meant I couldn't go to work. I couldn't support my family. And that was part of the element of this pandemic running rampant through these communities. And so we've got to appreciate that again, what the science has told us about why the rates are so high in communities of color should be turned around to the point where the first people in line to get the vaccine to crush this pandemic and prevent people from having it ought to put those same frontline workers and communities of color at the top of the list, not at the back of the list.
Well, you know, Dr. Wilder talked about the messaging and messengers, and the greater message and the greater messengers are you guys. You guys will have the people, as Dr. Wilder said, sitting right in front of you, in front of your desk, and you'll be able to dispel so much of the things that are not real, but yet do it with indignity and respect to get people moving down the direction they should to protect their families and their loved ones. Thank you so much for that. Mia, I'll turn it back to you.
Yeah, I couldn't say that any better. Thank you, Daryl. I want to bring up our poll question, our poll results, and ask Dr. Bryant. I'm going to put you on the spot here. You know, so a lot of people, about 60%, are saying that they have apprehensions about taking the COVID-19 vaccines. And given the conversation that your panelist colleagues were just talking about, fears and concerns, can you bring some light to expound on some of their answers, especially
Sure.
given what the results are saying?
Absolutely. There's a couple of things. Living in South Carolina, the baggage that we have in our community, you know, we can talk about what happened in those medical studies years ago, but also we need to talk about what's happened recently in our history. For us, it's Walter Scott being shot and killed by a white police officer, the Emmanuel 9 shooting of 9 parishioners being shot and killed while in church at Bible study. Those things make a difference when we're talking about the skepticism that people have. I understand that we don't want to harp on that, but we have to give people the space to be able to bring those things forward so that we can discuss it, because we know, because we're hurting right along with them. Also, I think a part of that shame, guilt that we talk about, very valid in many of those points, but also there's some level of what I don't know, I don't have to do anything about. If I don't get that, if I don't take that test, if I don't share that, then I don't have to take the acceptance of if I feel that I might have done something that may that could have put my family in jeopardy, or, you know, if it's not in front of me, I don't have to deal with it. Then we also can go to in South Carolina, when we don't have access for a lot of our individuals in our vulnerable community to healthcare. Well, when I get sick, there's nothing I can do about it. There's no place for me to go. So I don't necessarily want to know that. So I think there are multiple factors surrounding all of this, as we all know. But I think it was Dr. Wilder who said, and I agree with her 100%, our job is to understand how we listen intently and deal with what is in front of us at the moment. So oftentimes we don't even, we are not acknowledging those things that might be right in that space. So I'll stop there. Thank you.
Really appreciate you bringing to the forefront, and all of you really to a great extent, the fact that COVID-19 is just completely underscored tensions, social tensions, right? So a lot of the conversation here today is a non-clinical conversation. I mean, we're talking about a clinical intervention and innovation that has, a biological innovation, but we're also really talking about these intersectional issues, right? And so that really brings me to the next question. I want to bring Dr. Verrett in on this to talk to us about intersectionality. And by intersectionality, I mean specifically the term that was developed by Dr. Kimberly Crenshaw, which is it's a theory, it's a frame of mind that helps us to think through those layers of our most salient identities and how they bear on our health, right? So salient identities that are socially constructed, especially race, socioeconomic status, gender, with respect to gender and sexual orientation and regionality, geography, and coming from the US South, coming from an HBCU where majority of the students are young adults, majority are people of color. It's also an institution that is Catholic in its origins. How does intersectionality really play with respect to how particularly African Americans are thinking about and approaching the vaccine?
I would say that we approach how we interact with the medical system in many ways as each of us as many people. No one is just Black, no one is just a woman, no one is just of a certain sexual orientation. We are many things. Religion comes into it. Socioeconomic status is a complex factor because it also decides whether I have a personal physician with whom I can have that intimate conversation about my reticence to take the vaccine. So there are many factors, but also our experiences come in many layers. And I would say that we may also want to rethink whether it is just trust in the medical system that is at issue, because understand all American institutions have mistreated Black people in some way or other, whether it's the educational system, public safety systems, take our religion, so that all those complexities of mistrusting institutions also show up in how we approach other trusted institutions like hospitals and other institutions. So our approach to that is to understand where all these fears are coming from and to speak to those fears. At the same time, helping us to understand, because each of us can understand that despite the fact that we're mistreated by the public safety system or education, we don't turn away and say, I do not want education. So in other words, understanding that the mistreatments of the past are not a reason for looking at the future in a way that's saying, I will avoid traffic, I will not use traffic lights, I will not use safety belts, all those things that protect me. So understanding that basically, yes, we acknowledge the past, and your past is very burdened, but at the same time coming back and saying that now stepping into the future, here's a good reason to protect yourself and protect your children and your mother and your grandmother. That conversation needs to be had individually, not just globally as well, but also we need to prepare others to be able to have those conversations, whether it is my pastors who has very little biological knowledge, but we need to help them to take that step. We need others to be making those voices, because we need many voices to be able to help people take those steps over the line for something that really they will benefit. And also understand we are also Democrats and Republicans. So politics has been a factor, because the politicization of things like masks and also vaccines. In fact, the president of Dillon and myself, when we were vaccinated, we received an onslaught of people say, how dare you publicly take a vaccine? You're encouraging people to take a dangerous step to be vaccinated. That was because a week before, President Trump had said that he would have a vaccine by the election date. So in other words, are you on his side or on my side? So remember, we have complicated questions, and some of the questions are really not purely medical, but they are sociological in a very deep way. And that's why we need to interact with each other very directly and help to avoid the misinformation that each of us is taking on.
Absolutely, Dr. Verrett. I want to bring in Dr. Wilder to offer any additional thoughts to the same question. Intersectionality, why does it matter?
I keep muting myself. I think it's critical. And for what Dr. Verrett talked about, one, we're not an island in and of ourselves. And the other thing about the African American community and the African community within the United States is that we are a diverse community, right? And we have different opinions, different religions, different faith roles in our lives, right? And considering that at every moment as we start to let the public know about information as it relates to the vaccine is critical, because it means that the channels of information sharing have to be diverse as our community is diverse, right? So some people would say, okay, I'm going to fund the churches to get a message out. And that is a great way to get a message out to certain parts of the African American community. But then you also have to fund the mosques, right, to get the information out. And you also have to fund places of other worship, right, spiritual centers to get the information out, right? We know that like when we tried to do cardiovascular health and folks started to put resources in the barbershops, right, it was very effective in some communities, but in some communities, the solution is not in the barbershop. So I think this intersectionality question is a very important question, Mia, and it brings us back to how do we work with other communities too, right, with this issue?
Yeah, you said it really well. I mean, Dr. Verrett was talking about the role of this not just being a medical issue, this is a sociological issue. And it also goes back to Dr. Richardson Herron's point about meeting people where they are. Thank you both for those poignant points. I want to turn it over to Dow for another question. We're going to keep this conversation rolling.
Yes, and I said earlier, there's a intentionality, an intentional redundancy, if you would, that give doctors a chance to hear other people and things come to their mind. So we want you to hear everybody. So stay with us on that. This question speaks to, it asks the opinion on what would you name as the top barriers? And you may have heard that, but you'll hear some others. The top barriers to overcome in order to increase trust between the Black community and those administering the vaccine. And that's a good one, because whether it's, and we certainly shouldn't put our vaccine, those who administer it, in the area of police, all these different groups, because there's this mistrust in the air we're breathing. But this is critical for our people to hear, and that you will be delivering, our medical people will be delivering to them to get them safe. So let's start off with Dr. Richardson Herron to talk about the top barriers to overcome.
Right, thank you, Daryl. I just have to echo what Dr. Verrett said. We absolutely have to acknowledge the history and even the current, but we still have to interact with the healthcare system. And when we see the number of deaths, I mean, when you think about it, there are 2 people die every minute. I want to let that sink in just for a minute before I talk about the barriers. But 2 people are dying from COVID every minute of every day. That's a lot. So I think one of the first barriers to overcome is, as I mentioned, you got to have the right messenger. You got to, make sure that there are people who are Black and brown and white and all colors who are reaching out, faith-based, religious organizations, Greek organizations, anybody who could reach out. We've got to be reaching our communities. And as you said, Mia, meeting them where they are. Secondly, I think we have to ensure that we, have the right message. And I call it precision engagement. We've got to be very precise in what we say, but we have to deliver a message and break down the science in a way that is accessible, culturally sensitive, and resonates. And it's not one size fits all. For example, I mean, there's a study out there that talks about, or people are talking about, is there a microchip in the vaccine? We should be very clear and say, no, there isn't a microchip in the vaccine, period. end, full stop, right? The question I think came up earlier, can you get the vaccine from, can you get the disease from taking the vaccine? And I think we have to be very clear to let people know that the vaccines, mRNA vaccines, work differently. They don't, unlike other vaccines, contain any live particles, but instead they provide a recipe that teaches our own cells to make a part of the virus called the spike protein, a harmless part of that virus. And so, you know, since a vaccine is not live, you cannot get the virus from taking the vaccine. We have to explain that. But then we also have to talk about the speed. I mean, I have to be honest with you. I mean, I at Pfizer, and people are concerned about the speed. You know, it's a real concern. And I just want to reiterate that although our team worked at an unprecedented speed, vaccine safety was and will continue to be a fundamental priority for us. Think about it. In the age of social media, there's no company that wants to go out there with a vaccine that isn't right. It could destroy your entire company. You know, I want to give an analogy of how we were able to work at such a rapid speed. You know, when you think about it, you know, if you're going to buy a car, say next year, you start thinking about, well, how much is the insurance on this car going to cost? You know, do I need to clean out my garage? You know, what do I need to do? You know, so similarly in the development of our vaccine, we got all of our ducks in a row from an access, distribution, and supply perspective. And in addition to doing things way in advance, we made intentional steps to do some things in parallel. For example, as soon as we knew we were going to develop a vaccine candidate, our teams began selecting the sites for our clinical trial. They staffed up the clinical team, and just to make sure that we had systems and infrastructure around the world. And I'm just belaboring this a little bit to let you know that it was very intentional for us to be able to move so fast. And the other thing I want to say, you know, in the normal drug development journey, the process for preparing like the data that we submit to the Federal Drug Administrations and others for response often takes months. But because of the severity of COVID, you know, and its impact around the globe, regulators were responding to data very quickly, often in real time, so that things could move much more quickly. And then a lot of people say, you know, well, why couldn't we do this, you know, to find a vaccine to cure cancer or to cure, you know, other HIV or other diseases? That I can't answer. But I can surely tell you that the learnings that we have taken from this COVID vaccine, we're going to be applying them to other drug development because those other diseases are no less important. But it's very important to make you understand that the safety was and will continue to be our priority. And even if it wasn't ours, there are review boards and data safety monitoring committees that wouldn't have allowed us to move forward with a vaccine candidate if it were not safe and effective. And the last thing I'll just say is, you know, it's important to note that, you know, our trial alone contained 45,000 individuals with diverse racial and ethnic backgrounds. And that is so important because the bottom line is, if you're not in the trial, you may or may not benefit from it. But in this instance, we made sure of that so that we could test whether or not the vaccine would be safe in communities of color. So those are some of the things that happen. Those are barriers that we have to overcome to get that information out. But at the end of the day, it's a personal decision. But I want everyone to know that at this point, you know, this disease is a matter of life and death. And it's very important for us to at least make sure we're paying attention and not following Dr. Google. And I get a little upset with Dr. Google, but, you know, as a physician, but we really have to listen to the trusted messengers and get over that barrier of listening to our friends and family. You know, I no disrespect, but unless they're physicians or scientists or steeped in this or nurses in some way, shape, or form, we really should use trusted and reliable sources.
Wow, Dr. Herron, thank you so much. We needed to hear that. We needed to hear that. Dr. Shaw, will you please join in on this same conversation, the same subject?
So Dr. Herron said most of what I would say, which is, you know, really the first thing I think are familiar faces, and familiar faces with expertise really was the last point, right? So not just, you know, the favorite influencer on Google or on Instagram or on whatever it is that you're looking at, but someone who actually knows what they're talking about, who has studied this, who has a background in medicine at a minimum, but a background hopefully in understanding the immune system, vaccinology, and other things, and really leaning on that. And when I say familiar faces, I mean people who look like you. So in medicine and in research, we have a real problem with having a lack of Black and brown faces. And this group tonight is wonderful with all these Black and brown faces on the screen, but in the real world and everyday kind of clinical medicine, there are not that many of us around, as much as we should have, in my opinion. And so really making sure that the faces that are there are front and center to talk directly to people in our communities who are concerned, who have questions, to not really delegitimize the people's questions and concerns. And we've talked about that too, really, with acknowledging past abuses and current abuses that continue to happen, and really understanding and listening to why people are hesitant. And then step by step, trying to get them to understand the science behind the research for all these vaccines, the mechanism of the vaccine, the expected side effects from vaccines, and what we need to be concerned about and what we shouldn't be concerned about. And I would say really the last thing for me is transparency. And we've been, I think, better than in the past with research as far as transparency goes for these vaccines that have been under development. I've not seen publicly available in any recent years large swaths of information and data directly from companies about the medications, drugs, therapeutics, and vaccines that they're developing. And here we've been able to see from home all of the information once it's available to the FDA. And that is huge, to be able to look at the information, to look at the primary data, to look at the statistics that went behind it, to look at the subgroup analyses. All these things are important, and really just to be transparent as much as possible with the community, with individuals, so that they feel comfortable that nothing is being hidden from them, and that we really are making decisions based on the best data that we have. And I'll say one last thing, that it's 2021 now. We've made such leaps and bounds with the technology to get into the space that we are currently. And I hear lots of people say, well, vaccines usually take 10 years, 15 years to make. It's 2021. It is amazing that we were able to do this right now, right? But it's also, I think, what we should be doing in 2021. We should be able to make vaccines in the middle of a pandemic in a quick way, but in a safe way that's based on evidence that has been studied for decades, and all of the groundwork that's been going on for a very long time. So I'll stop there.
Yeah, take it from there. If you want to bring him, it's Dr. Barrett. It's on you. Now we can move.
Yeah, I just wanted to shout out how people are, talking about your social media presence. So I encourage all of you in the audience to look for everybody in terms of where they show up, whether in their place of work, and then if they're open to it, also being in touch via other realms. I want to go ahead and talk about, because some of you were also talking about the really the global presence, and we can't have a conversation about this pandemic without talking about the fact that it is global. On a personal note, I spent a third of my 20s living abroad. I first lived in South Africa and did research around HIV/AIDS. So I appreciate you bringing that up, Dr. Wilder. And then I moved to Southeast Asia and lived in Indonesia and worked with young people there. So it's very real to me when we have conversations, especially with my friends who live abroad and they have questions about what's going on in the US. We have the highest rates, but a lot of the issues are not unique in terms of the social factors that we're facing here that others are facing in other countries, in terms of the havoc that COVID-19 has wreaked. So particularly on Black and Brown and Indigenous communities. So, when we're talking about the various forms of the vaccines, and Dr. Richardson-Heron, you talked about this a bit before, what about representation? What are some early takeaways that we have, with respect to the development of the vaccines in various parts of the world and in terms of clinical trials? What are we seeing?
Well, with the Pfizer vaccine trial, we made it a priority to enroll diverse populations, as I said earlier, one that reflects the diversity of the world we live in, and also is inclusive of communities that have been disproportionately affected by COVID. Let me just give you some numbers. I mean, from a clinical trial perspective, the great news is that approximately 42% of the global participants and 30% of the US participants enrolled in our trial came from diverse backgrounds. And just to break that down a bit, about in the US, and I'll give the overall statistics actually. Asian, about 5%, which is about reflective of the population. Black was 10%. It's a little bit lower than the 13% of the population that one would normally see. For our Hispanic and Latinx population, 26%, right? And that's normally around 19% for if we were going to be reflective of the US. And Native American was about 1%. And at 1.1%, which is about right. It's important to highlight that these enrollment numbers are significantly higher than the average minority participation rate that we see in clinical trials, which I think is a really a good thing. And that in overall clinical trials, of course, in trials that are focused on African Americans, you might see higher numbers, but in general, these numbers are not as low as you typically see. And the sad thing, many of us don't know that many of the medications that we're taking have never been tested on us. I'm going to give you just a recent instance that highlights the importance of diversity in clinical trial. During the COVID-19 pandemic, many people have purchased or been asked to purchase small devices. They're called pulse oximeters. And essentially, you put them on your finger and it tells you and measures the oxygen levels in your blood. And clinics and hospitals, for example, use them regularly, to screen newborns for heart defects after birth, how much oxygen in your blood. But what we know is that these pulse oximeter measurements are imperfect, particularly for Black patients. There was a paper that demonstrated that Black patients are 3 times more likely than white to have a low oxygen levels that were missed by pulse oximeters. That's inappropriate. And why is that? It's because many of the technology developers didn't include people of color in the study. Now that's an abomination. It's an abomination. And sometimes I have to just be honest. Sometimes it's because we as people of color continue to be reticent to participate in clinical trials. So, as I say again, if you're not in the study, you might run the risk of not benefiting from the therapy or the treatment. So I think it's time for all of us to change the way, and I love what Dr. Verrett said, we have to change the way we interact with the healthcare system. We need to make it work for us. We got to make sure that we're in it to win it. And in this case, with the diversity in our COVID trial, it wasn't perfect, but I will tell you, I was so pleased that we were very intentional, making sure that the trial sites were in communities of color so we could break down the barriers of transportation and cost for participation. Being intentional and telling the investigators that it was important for them to focus. Don't just take all comers, make sure you have diversity. All of these things are very, very important. And so my prior job at the NIH I was focused heavy all on making sure that there was diversity in clinical trials. COVID is no different. Any medications are not different. And it's really important. This diversity must be achieved. And for the COVID trial, I can say without equivocation that because of the diversity that we had, we were able to determine that the vaccine was safe and effective in all communities of color.
Representation matters. I'm sure Dr. Gibbons has more to say to that as well. Thank you so much for that.
Sure. Just, I think we're amongst family here, so I appreciate the comments Dr. Richardson Heron said about the Pfizer trial. But the NIH has a strong commitment to inclusive participation. As she said, it's critically important as clinicians, when we write a prescription for you, Mia, as your doctor, I want to be able to look at you in the eye and say, yes, the reason I'm writing this prescription is because I know that it was tested and was effective in treating people who look just like you. And I think all of us as clinicians want to be able to say that about any treatment we prescribe. And that means we have to be represented in the clinical studies that shows that it's safe and effective. So that, again, those populations can be confident that it will benefit them. That's critical. I must say, we appreciate Pfizer's outcome. But literally, I was on weekly Zoom calls with a number of CEOs and from almost every vaccine trial, with every leader of Operation Warp Speed, the Surgeon General. It took a lot of intentionality to ensure that the outcomes were representative. This is not something that happens spontaneously. It takes proactive commitment and leadership at every level for those clinical trials to be inclusive, including obviously the willingness of the participants to be included. But it takes leadership all the way from top to bottom to make it so. That's critical. And that's where it's important, I believe, to have representation at every level of this process, from the participants to the research coordinators, to the outreach folks, to the nurses, to the principal investigators, to the members of the Safety and Monitoring Board, to the members of the advisory board of the FDA, and yes, to NIH and Operation Warp Speed and the C-suite of these companies, in order to ensure that indeed all the systems work together. This is really the challenge this pandemic has posed, because every institution is going to be called out to lean in and ensure that these products, that science saves the world, literally, and making sure that every community gets the benefit of that science, and the vaccines free, if not available, accessible, safe, and effective. And we have a strategy to make sure it gets in the arms of everyone who needs it. I'll stop there.
Yes, please, Dr. Richardson.
One thing, and I certainly support everything Dr. Gibbons said. One thing that I was remiss in mentioning in that intentional act to make sure everybody along the chain, I cannot thank enough the trusted organizations like the NAACP, the National Black Nurses Association, National Hispanic Medical Association, all of those grassroots community-based organizations that also helped us get the word out to the community as trusted messengers. I agree, this is an all hands on deck moment, and I just didn't want to stop without saying that these trusted organizations really made a significant impact in our success as well.
And I very much appreciate that. And something I meant to do after Dr. Bryant was speaking earlier is just naming, you named the organizations. She brought up names of those whose lives have been lost. It's important to really give voice to really the entire spectrum there. So thank you both for your leadership in that. And to bridge both of your comments, Dr. Gibbons and Dr. Richardson-Heron, leadership from on the organizational level, but then also on the individual level. It's hard to stand up in our own families, at our own tables, hopefully in our own Zooms that we hold between friends, because we're safe, safe distancing as much as possible, and being intentional about the conversation. So thank you both for bringing the tone with respect to leadership, commitment, representation, and intentionality. Thank you. Darryl, I'll turn it over to you for some of our final questions as we round into the last half hour here.
Well, this is so special. This is so special. I want to say to Dr. Richardson, Heron, and Dr. Barrett, that you guys advocated. You were on the inside. We don't know that. We did not know that. And you were on the inside. And I appreciate Dr. Barrett really clarifying that and talking about what it really took. And I appreciate Dr. Richardson, Heron, talking about the participation, and you guys were doing that on our behalf. And I want to say to you, on behalf of anybody that look like me, thank you, thank you, thank you. So now this section here talks about driving actionable change. You've done it there. Now, how do we do it? How do our doctors do it at the grassroots in the office level? Let's read this question. It says, what can we do to challenge the negative perceptions of the vaccine in communities of color? That's where you're sitting down, as Dr. Gloria Wilder talked about, and having an exchange with people. And so let's talk like we're taking notes. We're taking notes, we're taking your example, and we're gonna run with that. So talk to us in that term so that we can get it and say, this is how you need to communicate it. So why don't we start with Akilah, Dr. Shaw. Dr. Shaw, why don't you kick us off with that?
Sure. It's a great question. So I think really having open and respectful conversations is the place to start. Not shaming people who are hesitant, not shaming people who are not hesitant, providing all the information, again, back to the transparency point, the data, the science, and really just, again, Dr. Richardson Heron mentioned meeting people where they are. It's a really personal decision, right? If you're going to be vaccinated or not. But it's also a decision that's about our communities at large. And so I think, framing these conversations that vaccines are there to protect you, but they're also there to protect your family, your friends, your neighbors, your loved one, and your community. It's all about the collective in the end. So when you speak from a place of understanding and respect and just really having an open and honest conversation, I think most of the time, and also framing around not just yourself, most of the time, most people are receptive to that, where we can really kind of break down those barriers, that negativity that unfortunately during this whole pandemic, from politicizing all of the issues to many other things, lots of negative feelings that people have, lots of bad things that have been happening. But if we just kind of take a step back and talk it out, I think usually we can break down those negative perceptions.
So this question, and thank you for that, this question talks about challenge. How do we challenge the negative perception? When I was in 1965 at 5 years old, they had to hold me down for my vaccination. That sucker hurt, and I was only 5. So we're not holding people down, but in the spirit of that, there is a part of mama holding you down, you as the doctor, holding them down and helping them get it. Not so much get it by putting it in them, but get it in their minds. So talk about that, Dr. Barrett, when we really do challenge that, that individual.
I'm thinking myself, not purely as a scientist, but as an educator, that we know that we don't have enough African-American physicians or nurses around to be able to have all those conversations. So like, I remember myself in my classes teaching other students who are not specialists, and I'm the PhD, that I have to communicate to them and explain to them and give them the tools to go and take it further. So it's be important that we actually, and I'm watching the chat room, there are people who are taking notes and learning from us right now because they want to have other conversations. Yes. So we have to be able to educate others and give them the tools to be able to say what they, for example, to help them disabuse the misinformation. To understand that basically the vaccine will have side effects, but the side effects probably are a small 1-degree fever in the next 24 hours and Tylenol will help. They need to be able, we need to give them tools to be able to say that. Because when I heard Dr. Wilder earlier speaking about the barbershops for HIV communication, and even HIV venues for HIV testing, as they were done in New York in some cases, you have to give people the tools to be able to help to communicate to lay people. And we have to understand as specialists, we have to step away from our role and be able to give lay people, whomever it is, who has to go and have the conversation to help that man or woman come and get her vaccine. Because if we don't multiply ourselves, the game is lost.
Well, so Dr. Wilder, I do want to give you a chance to jump on this because I think this is very important, and you're there. You talked about it before, having that cross the table dialogue. So
yeah.
Speak a little bit.
Yeah, well, and I'll tell you, I really am moved by what we're all talking about because, it's about empowering our communities with truth, right? We have to tell the truth, right? The truth about any side effects that could potentially happen. Like Dr. Barrett said, tell the truth, right? You can get a low-grade fever, you can get soreness in your arm. When people ask me, did you get vaccinated? I say, yes, I got vaccinated. Why did you get vaccinated? Because I don't want COVID-19, I'm high risk, right? I don't want to die, right? And I made a decision for myself and my family, right? That it was worth it for us. But every individual has to make that decision. The second thing that I want to say that came up by Dr. Gibbons, and I think it's really critical that we don't miss this part. When we talk about the trusted messenger, right, we have to acknowledge that there are not enough trusted messengers in our communities, right? That we still have a low rate of African-American and Hispanic physicians in the United States. There's 1 million physicians in the United States. Only 50,000 are African-American out of 1 million. right? Only 18,000, around 18,000 are African-American females. When I went to medical school at Georgetown, I went from Howard to Georgetown. And when I went to medical school at Georgetown, we were 1.6% of the graduates of medical schools. Right now we're 2%. We failed, you guys. That was 26 years ago, right? So we did not increase the number of graduates. We did not increase the volume of Black nurses, of Black specialists out there. So we've got to talk about that, because this trusted role, what Dr. Gibbons said he needed to do on that call was he needed on that call to advocate, right, for diversity and inclusion in all studies. That's what he had to do on that call. That's what Dr. Heron has to do. That's what I have to do. We hold a door open for others who don't get a chance to walk through, right? But we got to push some people through, right? So that we have more diversity in the leadership of the organizations that make the decisions in health all across the United States.
And all across the board too. Dr. Bryant, you spoke earlier about, you know, the hesitancy that you see in the US South, and it's so very unique. You know, when you're dealing as a doctorate of nursing with your patients and those within your sphere of influence, what are you seeing in terms of ways to really move the needle forward toward trust?
So all of these points are so valid, and I think we all resonate in some way or another with something someone is saying. You'll be like, oh, so true, so true. I think another level of it for me, though, is, you know, when you're the person getting the call, and I know we all get them, you know, it takes a minute sometimes to absorb what you're hearing. And I think we have to then also offer the space where we're taking a step back and realizing, okay, now this is something new that I haven't quite heard before. And I don't know about you all, I hear some, you know, there's some things out there that we really have to deal with, such as Dr. Richardson, that the Pfizer vaccine was made for African Americans and Moderna was made for white folks. And so, you know, I want to get that one because that's the one that Joe Biden took. You know, every time I hear a new story, I think, okay, now where did this one come from? I read or heard the other day, you know, we're all talking about sharing our stories of having the vaccine administered, and folks are saying, now, if you all want to stop folks from getting that vaccine, keep sharing those shots out there, because, you know, that we're scaring some people. Also, you would be shocked that I heard this today, that the perception that because we are targeting our efforts to talk about the vaccine in our communities, that folks are believing that we are drawing them into something that's negative rather than positive, right? Why are you not making a special pitch to the white communities? Why is it only the special pitch to Black communities? So the stories go on and on. So I think we have to challenge ourselves to understand that at this point, we don't even know it all. And that our community and public health systems need to, the infrastructure there needs to become stronger. You're absolutely right. We do not have enough individuals that look like us that are out there, but we have failed miserably over the years of where our public health system, where they are and how we have them, how they are strong enough to be able to deal with this and so many other things that we know that's out there for the health and wellness of our community. And I've been concerned about that, and that still is concerning. Thank you.
Thank you.
Yeah, I know I speak for the panel when I say we share those concerns, right, Darryl?
Yes, indeed. Yes, indeed.
Yeah.
And Dr. Brown, I skipped you earlier. I want to keep you in this next question here that we have. What's different about our current context that would allow organizations to make sustainable progress to increase ethnic minorities taking the vaccine? And how could we translate these strategies and recommendations into tangible actions that everyday people can comprehend? And I think about that with, I think Dr. Gloria said, somebody said, not enough trusted messengers. And so we're talking about the context of the that allows the organizations to have a message that's sustainable as well. So would you please join us in this as well with Dr. Gibbons and Dr. Wilder, but Dr. Brown, will you just take that for me, please?
Sure. You said me, right, Dr. Bryant?
Yeah, yes,
sorry.
ma'am. Yes, ma'am.
Okay. All right. Well, there are a lot of organizations in our communities who are trying very hard. They call me, I work with them every day. The struggle that so many of them have is where do they find the resources? They're afraid. They're nervous about sharing good information. They sometimes don't know what to do. The resources, the opportunities to be good servants in this area. And again, I think we are focused and paying attention as we should now, but I still come back to public health and the health of our communities. It works in the background. As long as it's working, we're fine, right? Most people don't understand or know that there's somebody looking at our water systems or all those things that are happening. But when that breaks down, oh my goodness, the problems that we have. So we really have to raise the level, I think, of ensuring that we understand that we need to have a societal effort to strengthen our public health system. So all of these communities and partners and systems can work together and do it more effectively than they're doing right now. So that would be my message.
Excellent. Jump in there, Dr. Gibbons.
Yeah, no, it's a great question and challenge. And one of the things that we did, National Institute of Health as a research agency, was again to focus in on ourselves, checking ourselves and being sure we're trustworthy. And that as scientists and clinicians, that we are providing trustworthy, credible information. That's part of that battle against all that misinformation that the prior speaker, Dr. Bryant, said, and as well as linking into those who already have trusted partnerships. So the NIH and certainly our institute has funded community engaged investigators who've been working on the front lines, whether it's to prevent diabetes, prevent heart disease, to affect HIV. They've developed long-standing relationships with communities of color, because they're there in the front line, and they're in the clinic, and they're there in ways that are unconventional. Someone mentioned barbershops. Our agency actually funded the study to show that if you get information through something as a community asset like a barbershop in the African American community, that can be an effective way to help control high blood pressure. And so we've leveraged a lot of what research has told us may be unconventional ways for many communities, but work for there. The second part is someone mentioned that it's contextual. So that may not work in every place. And that's why when we developed the Community Engagement Alliance Against COVID-19 Disparities, SEAL, we started off with 11 teams, 11 states that were the hardest hit in communities of color, and challenged each of them that had these longstanding trusted relationships to develop innovative strategies that work for their communities, whether it's Asian, Latino, African American, whether it's in the Deep South or in the Midwest, and figure out what are the assets that could facilitate their inclusion in trials, as well as their acceptance, confidence, and implementation of vaccines. That program brought together local faith-based organizations, civic organizations, fraternities, sororities, health professionals, indeed congressmen and women, because it really is going to take a village within these communities of color. All the leaders in that all hands on deck work approach to empower and enable everybody. So where they have community health workers who don't have a single degree after their names, but we've given them the trusted information. They're the ones on the corner. They're the ones in voter registration lines telling them about vaccines. They're the ones at church telling about testing and getting their vaccine. That's where we need to mobilize everybody in the community.
Well said, well said, well said. Gloria, Dr. Wilder, just wrap us up real quickly before we jump into our Q&A, but I'd like to give you a last shot at that.
Yeah, I'll just say quickly that for us at Centene, I'd like to mention that something that, you know, our focus is local matters, right? We've known it from the beginning, right? When you empower local people to come up with their own solutions, those solutions tend to stick and they work, right? And we respect our local communities. So when COVID-19, when we all started hearing about coronavirus back in January, and we started seeing the data amongst our members, which 1 in every 15 Americans is a Centene member, right? So we had data, right? And we start to see this death rate in African Americans and Hispanic communities. What we decided really quickly is, how do we get resources at the local level, right? And don't give it, you know, at the top, right? We wanted to get it to the ground like that. And it reminded me of something I learned during Katrina relief when we got off the mobile units, right, 2 weeks after the storm, and we asked, how can we help? And they said, pick up a bucket. So everybody can do something to help with this, right? And we've got to get the resources down to the local level, and we have to believe in people again, right? And believe in their good intention to do the right thing by their own communities. Our COVID study with the National Minority Quality Forum is in 5 states right now, right? And one of the things that we learned is one of the best states that turned it around quickly was Louisiana, right? And Louisiana was able to enroll their 1,000 participants into this study, right? Within 2 weeks, 1,000 people got enrolled into a major study that required that they get a blood draw and things. Why? Because it was rural and it was local, right? And the doctor they believed in made a couple of phone calls to the pastor, to the mayor, to the fire chief, and within 2 weeks, 1,000 people were in the study.
Wow.
Local matters.
I bet you Mark Morrell had a little bit to do with that. Thank you guys so much.
This is great.
Yes, go ahead, Mia. Take us to the next level. This is really great. Thank you guys all. I'm just so honored to be a part of this.
I wish we had another hour or another town hall. That might be something that NMQF might have to think about, but we have 10 more minutes. I have 3 rapid fire questions for some of you. And this comes from the audience, and then we're gonna segue into a final poll question and then close out. So 1, Dr. Richardson-Herron, what's in the Pfizer vaccine? 2, this is for either and Dr. Jefferson-Shaw and Dr. Barrett, for immunosuppressant individuals and people with concerns to their immune system. Should they take the virus, or what are some considerations that they might want to keep in mind? And then finally, Dr. Wilder, what about the kids? Do they need to take the vaccine? So let's start with Dr. Richardson-Herron, if you wouldn't mind.
I'm sorry, I must have been on mute. So the Pfizer vaccine is an mRNA vaccine. And again, it doesn't contain any live virus. It contains inactive ingredients like potassium chloride, monobasic potassium, phosphate, sodium chloride, dibasic sodium phosphate dihydrate, and sucrose, and several other ingredients. One of the most common questions we get is, does it contain polyethylene glycol, which in some instances people have allergies to, and it does. And so for those people, they are being asked not to take the vaccine. But those are the components of the vaccine. Again, it has both synthetic and chemically produced components.
Thank you, ma'am. Either Dr. Jefferson-Shaw or Dr. Barrett, or both of you.
Repeat the question again.
But for those who are concerned in terms of immunosuppressant conditions and such like that, what are some concerns that you might want to dispel or highlight for them with respect to the vaccine?
First thing I would say is that for those who are immunosuppressed who have special conditions, they should be speaking to their physician. That's the first thing. But my understanding is that for people who are immunosuppressed, there are special protocols in some cases, for example, of removing them from the immunosuppressive agent before immunization. There are certain protocols that are being developed, right? But they should also speak to their physician, because they also must take special precautions anyway, not to catch COVID-19.
I don't have anything to add. I don't have anything to add to what Dr. Verrett said. 100% you need to talk to your doctor and have a conversation about that before making any decisions.
Thank you both. Dr. Wilder, what about the munchkins?
Yeah, take care of the kids, guys. Listen, 1 million have tested positive, right? About 100,000 have gotten sick and 133 have died. These are our children. I lost my son this year, and I'll tell you, no mother should lose a son. No mother should lose a daughter, right? So the only way to take care of children when it comes to coronavirus right now is to protect yourself and try your best to get vaccinated, right? Same way you're gonna take care of Nana and Grandma and Mima, all those, right? We gotta get vaccinated. Those of us who can, should. The studies on children are always gonna be last, right? For safety reasons. But the studies will start to happen, and they should happen, right? And we want to give those studies as much time as we can. So in the meantime, all of us grown-ups need to really figure out what the right thing is for us and our families.
Can I just add to that?
Please, yes.
Dr. Wilder, first of all, my heart goes out to you. I'm sorry about the loss of your son. I just want to say, in terms of our vaccine, it's approved for people age 16 and above, but we currently have about 1,000 participants in a study of 12 to 15-year-olds. And this controlled approach was agreed upon by the FDA to allow for initial safety assessments in a small group. Like Dr. Wilder said, you start with adults first, and then you plan for children. But we will be evaluating and assessing the participants after their second dose prior to conducting further enrollment. But we're very optimistic about, figuring out a plan for bringing in younger children, because they too are susceptible to the disease and don't always have good outcomes.
To harken back to something Dr. Jefferson Shaw mentioned, in the 21st century, we can do a lot with relatively short amount of time, particularly under crisis situations, but a lot is still going to be revealed over time. And so we have to make sure that we're using all of our resources, whether it be money, opportunities to come together like this, and then also time to really evaluate the issues. So thank you all for that. We have 4 minutes now left. And foremost, let me also add condolence, Dr. Wilder, to you and your family. Thank you very much for sharing that vulnerable piece of information. The truth is, we're all in such a very vulnerable state with respect to COVID, and we're in various states of grief, and that's significant to really acknowledge and to give space to. One of us or several of us talked about role of shame and transparency earlier. I hope that we're all finding spaces where we can be open in a safe and assured way. And hopefully this space is also that for a number of you who are joining us today. And make sure that you're cultivating spaces in your local arenas as well, as Dr. Wilder mentioned. So in the last 3.5 minutes that we have, I just want to ask our panelists to offer us just one word. Well, rather, before I do that, let's have the poll question come back, and let's see where people are landing at the end of this conversation. Do you still have apprehensions about taking the COVID-19 vaccine? And of course, and what I will say is, of the 200 and so odd people who have been on the call, I think at the height there were 307, 268 participated in the first poll, but keep me honest to that, Keiko. We're going to go ahead and take a look at what you have to say after we ask the panelists to just give us one word remark, parting advice. What does this moment mean? And where do we go from here? And you all can jump in as you feel ready.
You just want one word?
I know it's hard.
For me, it's hope.
I'll jump in. My one word is community.
My one word is faith. Have faith, guys. We will make it through this.
There we go.
I'll jump in with authenticity if I can get it out.
I guess I would go with beloved.
Mm.
When I think about Martin Luther King, he talked about beloved community.
Community, yes.
We're all interconnected, interdependent. Nothing like a pandemic proves that.
That's right.
My one word would be to be neighbor.
How about you, Daryl?
I'm just proud to know that we don't know all of you, but you're there. And also you do know that our audience is a subset of you. And so I'm just proud that, dude, yeah, our numbers are not where we want them to be, but we're there. So thank you, thank you, thank you.
And I'll say present in the double entendre that it is. Keiko, why don't you give us the final poll results if you wouldn't mind? All right, so what I will say, and let me be very clear. So we have a lot of people now are saying much more. 75% are saying that they have no apprehension about taking the COVID-19 vaccine, and this does not mean, obviously, that that you don't still have questions. You obviously still have questions. What we hope that you do is that you pass your questions on to NMQF so that they can do a diligent job of getting them to leaders who are similar to the ones on our panel today or they themselves. But we also want to echo what many of the panelists have said today, to continuously ask your provider questions about your own circumstance and whether or not the decisions that you're leaning toward making are useful to you and your family. And if there are other things, comments, again, give all of that to the NMQF family. This has just been a really phenomenal conversation, Daryl, and I'm grateful we've had it.
Man, yes, we should have been on national television, prime time. And I know that there's some way we're going to get this out to more people, but more importantly, all of you who are watching, we're counting on you to take the lead of these leaders, in terms of organizations and individuals who are in your field, and let's spread this thing like gangrene. And then others of us will be thinking about messaging and messages and mediums to push this thing out further so that we can take care of our community.
That's it, taking care for sure. And as we close, I just again want to thank our panelists. You all were fantastic. Dr. Gloria Wilder, who joined us today from Centene. We have Dr. Reynold Verrett, who joins us from Xavier University. Thank you, Dr. Akila Jefferson Shah, who's here from the University of Arkansas. Dr. Daryl Richardson Heron, of course, he's here with us from Pfizer. Dr. Gary Gibbons, who joins us from the NIH. We appreciate all that you and your colleagues are doing, so please make sure that you give our regards and hold each other accountable. And then last but certainly not least, Dr. Debbie Chapman-Bryant, who joins us from Musk School of Nursing. Thank you very much, all of you. Once again, I'm Mia Keys. I'm the Director of Health Equity Policy and Advocacy with the American Medical Association's Center for Health Equity. I'm consistently working with NMQF to raise conversations predominantly on Fridays at noon, and a number of people who are here with us today are our friends and come and join us on Friday. We hope that you will come for future conversations. There's another conversation coming up on this Friday, and if I'm not mistaken, it has to do with diabetes and how we can think about it in this moment. So with that, I hope all of you are staying safe, are staying hydrated, are surrounding yourself with energy-giving spaces. And last but certainly not least, I couldn't have done this conversation or have had a more enjoyable time if I weren't joined by Mr. Daryl Green and all of the energy that he brings. Thank you very much, sir. I wish we could have been in person. We always have a lot of fun when we're in person, but this is also really fun too. So I'm going to hand the microphone over to Daryl if he has any closing words, and then otherwise we'll hand it back over to Brandon.
Just want to say thank you. I've been privileged many times to be sometimes the face and the voice of service to young people, particularly for Centene Corporation, and I'm honored that they invited me to be a part of this. And Mia, thank you so much. Bless you. And we wish all of those who are joining us and who are watching us, let's spread this thing, like I said. God bless you all. Have a great night.
Thank you.
Yeah, and just to close this out, I don't know if I'm muted or not.
You're good.
But to close this, I can hear. Okay, thanks. I just wanted to say thank you to the panelists again. I know that is a lot of, I know you guys do this and you educate every day, but you took time to educate. We had over, I think the 300 people there, 600 registered, and we will continue to share this information and get more people aware. And we really appreciate it. My one word, I thought about it, and I think it's just necessary. And it's very necessary that we have this conversation and we continue to have conversations like this. I invite you to continue to join us and work with us at NMQF. You can always reach out, bgarrett@nmqf.org. I will get back to you and we'll have these discussions. And thanks again. Next week, we're talking about diabetes. In our big April summit, April 26th and 27th, we're talking about racism makes me sick. And that's going to be our topic for this year. And finally, just one last plug. We have a 40 under 40 competition. I think Dr. Jefferson Shaw is under 40 and she hasn't applied for this award yet. So I'm just kind of putting a soft plug, but for her and others like her that are doing the good work and educating and being great advocates in public health and equity, we'd like to see you apply and honored. So with that, everybody have a good week. I think this is a good start to the week. It's only Monday and there's so much more to do, but we've done a lot today. So have a good day. Oh, last but not least, thank you, Keiko Purnell. Thank you, Keiko.
60 is the new 40, man. Come on, let me in there.
There you go.
Well, you'll still beat me in the race, I'm certain. So. All right,
Thank you
guys.
for all
Have a
the-
great evening.
Have a good night, everybody.
Thank you for all the
Thank you.
hard work
Thank
that
you,
you all are doing in your leadership role. We appreciate what you're doing on the ground. We honor and appreciate your hard work to everyone. Thank you so much.